So good day. Recording today from Canada. Today is Monday, November 11. So I just wanted to post this video for public awareness and particular about the H5 avian influenza, or also known as bird flu. So for today's discussion, I will be talking about overview, the recent case, and any safety measures that we can do to protect ourselves. So if you haven't heard the news yet, on November 9, 2024, a teenager in BC tested positive for the H5 avian influenza, marking um, Canada's first confirmed human case of this virus. This individual is currently receiving treatment at a children's hospital in British Columbia, where specialists are closely monitoring their condition. Health officials are investigating the source of the infection, suspecting animal to human transmission. So Dr. Bonnie Henry, British Columbia's provincial health officer, has emphasized the rarity of such cases, noting that um, it's very rare, and the province is conducting a thorough investigation to fully understand the source of exposure here in BC. So while avian influenza primarily affects birds, it can occasionally infect humans, typically through direct contact and with infected birds or contaminated environments. Human-to-human transmission remains extremely rare, and there is no evidence of sustained transmission among humans. So this is according to the news release from the BC government. The Public Health Agency of Canada continues to monitor the situation closely, collaborating with provincial health authorities to implement appropriate public health measures and prevent further transmission. So what the public needs to be aware of, again, is that this is a rare but very rare, but it's a very rare but serious condition. Human cases are rare but can lead to serious health complications, right? Prevention is key. So understanding how to reduce the risk of exposure to the virus is crucial, especially for those in close contact with birds or bird environments. Public health measures that we should be aware of are that authorities are taking steps to prevent further cases, and the public cooperation is essential for controlling the spread of the virus. So if you'd like to know more about this, you can go to the BCCDC website and the Public Health Agency of Canada. So I want to dive into this a bit more, particularly about understanding what is H5 avian influenza. So this again is a disease that's commonly known, also known as bird flu. It is caused by a virus that primarily infects birds. So while it mainly spreads amongst birds, there are certain strains that can infect humans. Although, again, this is very rare. In Canada, in particular, the avian flu virus has mostly been a concern for bird populations, and occasional cases in humans have prompted preventive measures. Right? This is according to BCCDC. How does the um, virus spread? It spreads through bird-to-bird transmission. So it spreads easily among birds through their saliva, through their nasal secretions, and through their feces. It can also be through bird to human. This occurs through contact with infected birds or contaminated environments. So, for example, touching bird droppings, feathers, or being near sick birds. Again, human to human transmission is extremely rare, and It's not easily spread, unlike the common flu. It does not spread between people. So again, this is from BCCDC and the Public Health Agency of Canada. So what are the symptoms in humans? So the early symptoms can be seen as coughing, shortness of breath, fever, aching muscles, or headache, right? Other early symptoms can also include, because, depending on the individual, they may have different um, symptoms, right? So it could be diarrhea, runny nose, sore throat, fatigue, conjunctivitis, red eyes, bleeding gums. And so before that, so if you have been working around sick birds or dead birds and you um, display the symptoms, right? Again, the transmission from bird to human is, um, you know, possible by direct contact with infected birds or working in contaminated environments. So you have to be aware about these early symptoms are. In rare cases, when the symptoms progresses, this can be seen through as difficulty in breathing, right? With in in if your doctor sees you, you can have pneumonia or acute respiratory distress syndrome. You can even have neurological changes or changes in your mental state or seizures, right? So we have to make sure your doctor is also aware that you have been exposed to um, infected birds or you work in areas that have been contaminated, right? How do you protect yourself and your loved ones? Um, so number one is obviously avoid contact with birds. Stay away from sick or dead birds. In BC, if you find a dead bird, you can actually report it to local health authorities, such as the BC Wild Bird Mortality Line. And the phone number for this is 1-866-431-2473. Again, the number for the BC Wild Bird Mortality Line is 1-866-431-2473. Avoid touching live birds in markets or farms also, right? Um, you should also be practicing good hygiene. Never fail. So wash your hands, use soap and water, especially after touching birds, bird products, or being outdoors. If soap isn't available, use an alcohol-based hand sanitizer. And if you do touch, a dead bird and you haven't washed your hands yet, avoid touching your face. This will help prevent the virus from entering your body through your eyes, nose, or mouth. You should also practice food safety, right? Always cook poultry and eggs thoroughly. The internal temperature should be around should reach 74 degrees Celsius or 165 degrees Fahrenheit to kill the virus. Use separate utensils for raw and cooked food to avoid cross-contamination. And again, there's a lot of health information about around this BCCDC and then Health Canada. There's also cultural practices that we can put you in higher risk, right? So I'm not going to identify the culture, but if you do this, then please make sure to protect yourselves. So for example, um, activities like buying live poultry at markets or using birds in the traditional rituals, right? Um, if you prepare birds at home, you slaughter birds at home, right? This can expose people in your home to the virus if proper precautions are not taken. Also, if you eat raw or undercooked poultry, right? This can be risky. So protect yourself, use protective gear if you have them, cook all poultry thoroughly, and then consider safer alternatives for uh, traditional practices that involve birds, right? So can look up Public Health Agency of Canada for more information again. There may be also, if you work in the field, there may be impact you as well. And I'm not fully versed into this, but it could involve any of the following, right? It could be increased health surveillance, right? Enhanced monitoring and regular testing, where the employers will ask the workers to um, participate in checks and testing. It could include stricter biosecurity measures, where poultry facilities um, will introduce stricter biosecurity practices, such as the use of PPEs or personal protective equipment, routine disinfections, and limiting access to areas where birds are handled. Could involve more training, education. So being trained to recognize symptoms of avian flu and following safety guidelines. And the training is being provided in hopefully in multiple languages, because in Canada, for example, a lot of the employees working in this sector could be newly landed immigrants. They could be temporary foreign workers, or they could also be refugees, right? So there's some cultural language barriers there as well. Um, yeah, hopefully there's also improved access to healthcare regardless of status, right? Because uh the reality is that a virus does not distinguish if you're a legal immigrant, you're a temporary foreign worker, or a permanent employee. It will still cross across uh, that barrier. So hopefully there's improved access, and support services may also be important, like mental health resources and navigation help for navigating the healthcare system in particular. This again is particularly important for those facing language barriers, or those who have um n no understanding or not fully aware of their rights. So um best source for information about this would be either the Canadian Food Inspection Agency, or CFIA, and also the Public Health Agency of Canada. So in Canada, there's public health guidance that have come up, right? So for example, for across Canada, there's the Public Health Agency of Canada is working with provincial health authorities and industry stakeholders to monitor and contain the virus. Um, Healthcare professionals are advised to follow strict infection control when treating suspected avian flu cases, and the agency, in this case, the Public Health Agency of Canada, is focusing on public education about the importance of hygiene, food safety, and being informed during outbreaks. For specific provincial measures in BC, right? We can um, um, the BC CDC encourages reporting dead or sick birds and practicing proper hygiene. Also, officials have implemented measures to protect both the public and industry workers. So again, you can look up more information at BCCDC or the Public Health Agency of Canada. In conclusion, stay informed, practice good hygiene, follow public health recommendations, and all of this will help prevent the spread of avian flu and protect all of us. So more updates, visit the BCCDC and the Public Health Agency of Canada.